Hello, I'm Audra. I'm going to be your nurse today that's handling your discharge. Um, would you please tell me your first and last name and date of birth? Thank you so much. And your wife is present. Is that okay if I teach both of you about your new medications? Great, thank you so much. So you were admitted a couple of days ago because your blood sugar was very elevated and you have a new diagnosis of type 2 diabetes, and also your blood pressure was elevated. So I'm going to go briefly over your home medications that you're already somewhat familiar with, and then I'll go over your new medications. So you take Synthroid 100 micrograms every day, and so that's a hormone replacement. It's also known as levothyroxine, and this is to replace missing thyroid hormones because your thyroid does not make enough. And this medication is taken lifelong. You need to make sure that you're going to get your lab work done routinely to check those levels to see if it needs to be adjusted, to see if the medication needs to be adjusted. And so this medication needs to be taken 30 to 60 minutes before breakfast each day, and it should be taken with a full glass of water. And also make sure you report to your doctor if you have a headache, if you're feeling that you're having nervousness, diarrhea, excessive sweating, heat intolerance, increased heart rate, or chest pain. Those definitely need to be reported to your doctor if you experience any of those things. Now, do you have any questions regarding levothyroxine? Okay. And your other home medication is Protonix, and you take that for your acid reflux. And Protonix works by reducing the amount of acid in your stomach. It's important to avoid alcohol and products containing aspirin because these can cause irritation to your stomach while you're on Protonix. And this Protonix can make you more susceptible to bone fractures, vitamin B12 deficiency, diarrhea, and abdominal pain. So make sure that you're monitoring your bowel movements. If you experience diarrhea, abdominal cramping, a fever, bloody stools, any of those things, you should notify your doctor. Do either of you have questions regarding the Protonix? Okay, so now we're going to go over your new medications that were prescribed during this hospitalization. So the Lopressor, you're taking Lopressor 50 milligrams every day, and it's also known as metoprolol. This medication was prescribed due to your blood pressure being elevated. Over the last few months, your doctor has been monitoring your blood pressure, and it has been increasing. So the Lopressor will help lower your blood pressure, and it can lower your heart rate also. So it's important to check your heart rate before you take the Lopressor. If you're able to purchase an automatic blood pressure cuff, that would be great. So you're able to check your blood pressure before you take this medication, because you should also be checking your blood pressure. And we can go over how to use an automatic blood pressure cuff, and we'll also go over how to check your heart rate so that you and your wife are both familiar with how you can check that manually. And if your heart rate is in the 50s or lower, then definitely hold your medication, hold the Lopressor, and you need to notify your doctor. And it should be taken at the same time every day. And you should not stop abruptly. If this medication is stopped abruptly, it can cause life-threatening side effects. Another side effect for this medication, it can make you sensitive to cold. So make sure, and also it can cause your blood pressure to drop when you change positions. So make sure that you're changing position slowly. For example, if you're going from a sitting to standing position, make sure you're doing that slowly so that you don't become dizzy and fall, because that will cause your blood pressure to drop if you're changing positions too quickly. And also, something very important about this medication is it can block the warning signs of low blood sugar, except sweating. It doesn't block sweating, but it does block warning signs of low blood sugar. So it's very important for you to monitor your blood sugars very closely while on this medication. It's also important to exercise regularly, to reduce sodium in your diet, to refrain from smoking. If you need any help, if you are a current smoker, I can give you information on how to quit smoking. And it's also important to reduce stress in your life, and that will all help lower your blood pressure along with the medication, because blood pressure controls blood pressure, but it's not a cure for high blood pressure. Another medication that you are prescribed is Zestrol. It's also known as lisinopril. You're prescribed Zestrol 10 milligrams daily. It has been a medication prescribed to treat your high blood pressure, and our goal is to lower your blood pressure with minimal side effects. Zestrol does have some possible side effects that I would like to go over with you. It can cause swelling of the face, eyes, lips, or tongue, which can lead to difficulty swallowing or breathing. And a swelling could occur at any time during your therapy. It could happen a week from now or 2 months from now. It could happen anytime. And if that occurs, you need to, if you're experiencing swelling, you need to seek medical attention immediately. And also it can cause a persistent dry cough. And that's a common side effect of Zestrol. If the cough becomes irritating, contact your doctor so we can, see what we can do about that. And make sure to steer clear of salt substitutes that contain potassium, because you are more susceptible to high potassium levels with Zestrol. So make sure you stay away from salt substitutes that have potassium in them. Mrs. Dash is a great salt substitute that has little to no potassium. And for the best results, the Zestrol should be taken at the same time each day. It's also important to monitor your blood pressure and, of course, again, to change positions slowly to avoid your blood pressure dropping and you becoming dizzy. Your final new medication is the metformin 500 milligrams that you're taking daily. And this medication was prescribed due to your new diagnosis of diabetes. And metformin helps to maintain your blood sugar levels. Metformin does have some side effects, mostly related to your stomach. Some of the side effects are bloating of your stomach, diarrhea, vomiting, and a metallic taste in your mouth. So make sure you notify your doctor if you're experiencing diarrhea, nausea, vomiting, or stomach pain to minimize the unpleasant side effects. From your stomach side effects, you should take the metformin with a meal. So for you, that will be breakfast, most likely. And make sure that you're getting your A1C checked regularly. The A1C is a blood test to tell you your blood sugar average over a 3-month period. And that's done to evaluate how effective the medication is. And your kidney functions also need to be checked while you're on metformin. Make sure that you notify if you are having any procedures with dye, contrast. Make sure that you notify that before any medical procedure, make sure you notify the doctor that you take metformin. And it also is recommended for you to carry a form of sugar such as hard candy with you while you're on this medication in case you experience low blood sugar. And quickly, I want to tell you about low blood sugar signs. The signs of low blood sugar are sweating, rapid heartbeat, hunger, dizziness, irritability, confusion, difficulty concentrating, and fatigue. So you do need to monitor your blood sugar closely while you're on this medication. And now, since you are type 2 diabetic, it's very important for you to be monitoring your blood sugars closely. Okay, now that we've gone over all your medications, please let me know what questions or concerns you have. Thank you very much.